And on this busy Tuesday night, let's bring in Kansas Republican Senator Dr. Roger Marshall. Thank you so much for joining us, Senator. President Trump today indicated hundreds of thousands of furloughed federal workers may not receive back pay automatically when the government reopens. During Trump's first term, Congress passed a law that guaranteed back pay for federal workers. As you know, many are relying on those checks to pay their rent and bills. Is it your understanding that they should receive back pay?
Well, Lindsay, as long as they're not fired, I think some of these people will probably end up being fired, and those are the ones that probably would never receive any back pay, so to speak. But we'll see. I hate to ever speak for the president.
We know that President Trump said yesterday that he was negotiating with Democrats. Shortly thereafter, Senator Schumer said that's not true. So are those conversations happening at this point?
Well, Lindsay, they are, but I think we have two different issues going on. One is funding the government, and the other one is fixing these temporary COVID subsidies. I think they're two very distinct issues. I want you to remember this, that Chuck Schumer, the last 5 years, has voted for over 50 continuing resolutions, over 50 stopgap measures. He voted yes on every one except this one. That's what leadership typically does. And then we have fights over these other issues like the COVID subsidies for the ACA. I'm very willing to have those discussions. Those talks are starting, but want to make it very clear we need to open the government so we can actually solve those problems.
We saw the fireworks in the Senate today between A.G. Bondi and particularly Illinois Senator Dick Durbin. At one point, A.G. Bondi said to him, "I wish you'd love Chicago as much as you hate President Trump." They were squaring off over National Guard deployment. Taking a step back, are you concerned about American citizens increasingly seeing more armed military on the streets?
No, what I hear from people across America, especially in Kansas, is that they're concerned for their safety and well-being. They're thrilled that the border is secured, but we still have so many murders and violent crimes in all of these states, especially blue states. We saw how President Trump cleaned up what was going on in Washington, D.C. So I think first and foremost, I'm a father, I'm a grandfather, I worried about the safety of my family, and the crime is out of control in some of these cities. So I think that people are glad that President Trump is stepping in there with limited roles for the military to be backup for the police.
On Monday, the acting CDC director officially signed off on new COVID shot guidelines that could make it potentially more difficult for anyone who wants to get their shot this winter. The guidelines say people should talk to a doctor, pharmacist, or some other healthcare provider about the risks and benefits of getting vaccinated before they get a shot. Here's what your fellow doctor, Republican Senator Bill Cassidy, said about these late yesterday.
To tell people, oh, wait, we're going to put one more barrier for you to get the COVID vaccine. Means that many fewer people get it. It is not science. It's not what's good for America. It's not making America healthy again. It's how do we screw with the American people's health because we have a prejudice against this vaccine.
Are you and Senator Cassidy aligned here?
Well, probably not. I believe that this is up to the patient and the doctor relationship to sort this out. Look, these vaccines are just like drugs. They have side effects, they have risks, they have benefits. And I think especially the COVID vaccine has a lot of side effects that patients need to know about. I don't think that we should give this out like candy. I think it has a lot more side effects than, say, the flu shot does. I think it still is going to be very easy for any person in America to walk into a health department, to walk into a pharmacy and get this vaccine if they want it. But I really would encourage them to talk to their doctor first, especially for young adults who see very minimal benefit from the vaccine, but a lot of concerns and risk.
Obviously, you wear a lot of hats as a senator, a doctor, a father, but I want to ask you this one in particular as a grandfather. On Monday, the acting CDC director also posted, "I call on vaccine manufacturers to develop safe monovalent vaccines to replace the combined MMR and break up the MMR shot into 3 total separate shots." Vaccine maker Merck says there is no published scientific evidence that shows any benefit in separating the MMR shot. You've called the MMR a great vaccine. Do you think that it's necessary to break up the MMR vaccine?
As far as I know, it's not. I do think it's a good idea to break away the varicella, the chickenpox part of this. The chickenpox vaccination given with this had a fair number of febrile seizures as well. I'm not aware of any studies contradicting the need to break up these 3, but I'm always concerned about cross reactions. Just like taking medicines at the same time there's cross reactions. I guess there would be some potential of cross reaction between the 3, but I'd want to see the studies. At this point in time, I'm okay with the MMR being together.
Senator Roger Marshall of Kansas, we thank you so much for your time, Senator.
Thank you.